Welcome to Life Esteem, a program committed to delivering information that's important to you and your community. Your hosts are Nathaniel and Patricia Gadsden.
Well, welcome again to Life Esteem. Always great to have you as a viewer. Today we're going to talk about a program called Gift for Love. I think I said it right. And it is the Pennsylvania Department of Health. We have with us Brandy Hunter Davenport and also Judy Oakes, and they're going to tell us all about this program. Welcome to the show.
Thank you for having us this morning.
All right, real good. So what is Gift for Love?
The program that we actually launched on Valentine's Day. It's an initiative to help people who use tobacco quit. And when we launched it, it's called Quit for Love, and it talks to not only the person who is using tobacco, but for all the people who are around them, love them, care for them. And we are trying to reach them to tell them Pennsylvania has an incredible resource to help them stop using tobacco.
Now, when I started off, I was saying, did I say quit or did I say gift?
He said gift.
You said gift.
I thought I said gift.
Either one fits because it truly is a gift as well.
It is a quit for love, a quit tobacco.
Yes.
Really? Okay.
So the program itself, we actually are offering free NRT, which is nicotine replacement therapy, to individuals looking for assistance in their quit attempts. What we're finding, and as I've learned from working with Judy, is that most individuals are more likely to be successful if they are using an NRT product as well as getting counseling. So we're offering everything through our 1-800-QUIT line to individuals to help them with their quit attempts.
How big of a problem is this?
When I first started with the Department of Health nearly 13 years ago, the adult tobacco smoking rate was at 25%, and it had stayed there for at least a decade. I'm happy to say we have moved that needle. It's a big needle to move. When it was 25%, it was estimated there were about 2.4 million people smoking. Today, it's at 18%, but it's still 1.8 million who are using tobacco and smoking. And so, as Brandy said, this initiative is tapping into our knowledge and what we've learned over time. Just as when you start using tobacco, it takes practice to learn how to smoke. Quitting also takes practice. But the good news, the message is that every time you make that quit attempt, there's a layering effect and you increase the odds that you will be successful. Quit for Love does take it to that next step. We know the combination of using nicotine replacement therapy, and we use the patch, combined with good coaching that is one-on-one. When you call our quit line at 1-800-QUIT-NOW, you will go through a registration process. They have to get some information. They will ask you about tobacco use, how long you've been smoking, how much you use, and that determines the strength of the patch that you will receive. You'll get a coaching session. You must complete the first one. You'll get a medical screening to make sure it's safe for you to use the patch, and then they will be shipped to you within a couple days of that. Then you can set up additional coaching sessions, up to 5, where they will call you at a time you say is the best time for you to be reached. And you can receive that ongoing coaching as well as the patch and that's a 4-week supply of the patch.
It's very comprehensive, the approach that you're using. So if I'm hearing you correct, Judy, what you're sharing and saying is that maybe just smoking cessation classes aren't enough.
For some individuals, it may not be enough. I mean, smoking is an addiction. It is an addiction, and it's something that's hard to break because your body gets used to having that nicotine. You're craving it. So we're realizing that we need to give you as many resources as possible to put you in a position to quit and be successful at quitting. Because you have some individuals who may be able to do it cold turkey. You know, this isn't a cookie cutter science here. There are other individuals who may try, and at some point in time, something may trigger them to go back. So we're really trying to push that coaching piece as well while we supplement with the NRT so the individuals can find out what best works for them. And I'm not sure if we've said this, but this is absolutely at no cost to the individual who calls. So don't think we're sitting here today trying to promote something that you have to pay for. This is free, and it's going to benefit your health. So that's what we really want to get across to individuals. This is free.
And anyone who tuned in late, we use acronyms a lot. We say NRC. Is that
NRT, nicotine replacement therapy.
Nicotine replacement therapy. Okay, we got that. Okay. You know, 2 quick stories. My mother died of lung cancer from
And so did my mother.
And your mother as well. And I watched them both struggle. And even when my mother was diagnosed with cancer, I remember the doctor saying to me, you know, don't try to stop her from smoking. I mean, at this point, it's so aggressive and everything. He said, let her be at peace. You know, he said, it's such a difficult thing to break. You know, you just put, more pressure on her. You know, he said, so don't do that. And then a dear friend of mine, I remember traveling down, working for the Department of Education, traveling down to Philadelphia on the train. And she was trying her best to kick this habit. She talked to me from Harrisburg to Philadelphia about this, you know, nicotine replacement therapy she was doing and all the different things, and she could not stop talking about it. Within 3 months, she died of a massive heart attack. And she worked for, you know, a state agent. She worked for agent. That's right. So it's just a tragedy. Just those two stories always stick out in my mind in terms of how difficult of a problem we're talking about. So I just want to kind of frame our conversation today about that. Yeah.
And thank you, because I think stories are a powerful way to get messages across, and your stories are very compelling to support our message, because it really doesn't matter what age you quit. There are definite health benefits for everybody. And so we've learned a lot over the years, and we can change the outcome of those stories.
Exactly.
We know that, and I speak as a former smoker, I have great empathy for smokers today. I quit when there was no digit in front of the decimal point for the cost.
Thank you.
So it was very different. And it's a challenge. I mean, it really does take practice, but I don't think we should, it's as Brandy said, this is a true addiction. The nicotine is the drug delivery system that's in that tobacco, and that hits your brain within 3 to 7 seconds. It's powerful. We also need to be thinking about our children and their futures, and one of the things that we know is that the majority of smokers start before they're 18, and it's still that way.
That's right.
The tobacco industry targets our kids. They are used as replacement smokers, and so the sooner they can get them addicted, the better. And it can take only 3 cigarettes now to addict a kid. That's wrong. We can do something about that. Quit for Love helps people now because Pennsylvania has a smoking ban. Smokers are more visible. They're outside. They're not allowed to smoke in their workplace. And so we see more of them, and we think so many of them are, there's so many people who smoke. It's not true. They're more visible. And we need to befriend them. We need to talk about this Quit for Love, and the fact that you don't have to do it alone. You don't have to do it in secret. For the African American community, we know that working directly with the faith community carries a very strong message. We don't have the credibility in the health department. There are barriers, there are disparities with populations, access to care. This is a program that eliminates all of that and creates the opportunity. We also know that a lot of people have access to computers and use them. So in addition to 1-800-QUIT now, there's also a website, and it's www.determinedtoquit.com. Filled with resources of hundreds of things you can do instead of picking up that smoke. Resources that are available, messaging that's available. It also has the information about the nicotine replacement therapy, the patches, and the quit line for the initiative that we're doing.
Fantastic.
And there are local resources on that website as well. Good. So even if someone out in the Pittsburgh or the Southwest area, or someone down in the Southeast area is looking for some type of resource, and they're saying, okay, but they're in Harrisburg, we've got a ton of resources listed for local assistance, because a lot of people want to do this anonymously. They don't want to be seen. They don't want their face added to this. But then you do have some individuals that say, hey, I need to reach out and touch somebody. So it's nice to be able to say, here's a phone number where you can call and you can talk to someone and maybe even go in for additional assistance.
Good stuff.
Yeah, you said this particular initiative campaign started around
we launched it on Valentine's Day, to carry that love message.
Yes.
And we speak about loving yourself, caring enough to make that change, loving somebody, willing to make that change. And you and I have spoken before about our children and the impact that has had.
We did. Yeah, absolutely.
That was, and also about women and smoking and the differences, where men will frequently try to go cold turkey, which is, we know, is for some successful, but not for, it has a very lower success